Welcome back everyone. Now I will discuss about Ophthalmia Neonatorum or neonatal conjunctivitis. To start from the definition, Ophthalmia Neonatorum or neonatal conjunctivitis is a conjunctival inflammation occurring during the first months of life. And we classify Ophthalmia Neonatorum into aseptic and septic. Aseptic neonatal conjunctivitis or aseptic Ophthalmia Neonatorum is most often a chemical conjunctivitis that's induced by silver nitrate solution, which has been used at birth for prophylaxis of infectious conjunctivitis. Chemical conjunctivitis is becoming less common owing to the use of erythromycin or TTC ointment in place of silver nitrate solution for the prophylaxis of infectious conjunctivitis. When we see the septic neonatal conjunctivitis, viral and bacterial infections are the leading cause of septic neonatal conjunctivitis. The two most common infectious causes of neonatal conjunctivitis are Neisseria gonorrhoeae and Chlamydia trachomatis, typically acquired from the birth canal during delivery. However, other different bacteria and viruses can be the cause, including herpes simplex virus type 2, Staph aureus, strep pyogenes, and strep pneumonia. When we see risk factors for neonatal conjunctivitis, the first one is maternal infections carried in birth canal. So that is why active genital herpes is contraindicated for vaginal delivery. And also exposure of infant to infections, human immunodeficiency virus infected mothers, ocular injury during delivery, inadequate ocular prophylaxis immediately after birth, premature babies, poor antenatal care, and also poor and unhygienic delivery conditions are another risk factors for having Ophthalmia Neonatorum. Post-delivery exposure to infection is also sometimes can cause Ophthalmia Neonatorum at the delivery ward. When we see the clinical manifestation of Ophthalmia Neonatorum, chemical conjunctivitis present with mild redness of the eyes and also slight swelling of the eyes after few minutes to hours of application. And mostly it resolves spontaneously within 2 to 4 days. Ophthalmia Neonatorum due to Neisseria gonorrhoeae typically manifests during the first week of life, especially in the first 5 days after birth, and it is associated with marked bilateral purulent discharge and local inflammation. In contrast, conjunctivitis secondary to infections with Chlamydia trachomatis produce conjunctivitis 5 days to 2 weeks after delivery. The discharge is usually more watery in nature and less inflamed. Babies infected with chlamydia might develop also pneumonitis in addition to the Ophthalmia Neonatorum at later age at around 2 to 19 weeks after delivery. So that causes a febrile pneumonia of infancy. This image shows a newborn having eye discharge and also red eye, and this one is the second one is it shows excessive amount of eye discharge which is purulent, and the second one looks like it is a Neisseria gonorrhoeae etiology. So Neisseria gonorrhoeae produce copious purulent secretion compared to that of the Chlamydia trachomatis. Chlamydia trachomatis produce slightly purulent or less thick than that of the Neisseria gonorrhoeae. Regarding laboratory diagnosis, Ophthalmia Neonatorum is diagnosed clinically by looking at red eye, eye discharge, and also eyelid swelling. But to identify the cause for the Ophthalmia Neonatorum, we should have to investigate some of them. For Chlamydia conjunctivitis, conjunctival scraping for gram stain and Giemsa stain, and conjunctival scraping is taken and the eye exudate is not enough to look for chlamydial conjunctivitis, since the causative agent is obligate intracellular parasite. But it is rarely gram-stained like other gram-negative bacteria, because chlamydia have an outer membrane that contains lipopolysaccharides and membrane proteins, but their outer membrane contains no detectable peptidoglycans despite the presence of genes encoding proteins for its synthesis. So it is rarely gram-stained. So we should have to do conjunctival scraping for PCR, which is the best diagnostic method for chlamydia. Regarding Neisseria gonorrhoeae is a gram-negative coffee bean-shaped intracellular diplocus on gram stain, and culture on chocolate agar or tire Martin medium or conjunctival scraping for PCR can diagnose Neisseria gonorrhoeae. Neonatal conjunctivitis should be differentiated from congenital obstruction of nasolacrimal duct, dacrocystitis, bacterial keratitis, periseptal cellulitis, orbital cellulitis, and also congenital glaucoma. When we see treatment of Ophthalmia Neonatorum, chemical Ophthalmia Neonatorum is a self-limiting condition and it does not require any treatment. Regarding septic Ophthalmia Neonatorum, if the etiology is bacterial or viral and if it's left untreated, babies are at high risk of developing corneal ulceration, ocular growth perforation, and also permanent blindness, especially in the case of Neisseria gonorrhoeae. Regardless of which organisms caused the infection, frequent saline irrigation and the cleaning of the eyes is necessary to remove the eye discharge. For gonococcal Ophthalmia Neonatorum, the recommended treatment is a single dose of intramuscular ceftriaxone injection, 15 mg per kg of body weight, or 125 mg. For Chlamydia Ophthalmia Neonatorum, or sometimes called neonatal inclusion conjunctivitis, the recommendation is 50 mg per kg of erythromycin syrup in 4 divided doses for 2 weeks. For Chlamydia Ophthalmia Neonatorum, topical therapy is not effective and it also does not treat the infections of the nasopharynx. So topical treatment doesn't prevent the later occurrence of a febrile pneumonia of infancy. So always we should have to treat systemically. Other bacterial Ophthalmia Neonatorum should be treated by broad-spectrum antibiotic drops and ointment for 2 weeks. Herpes simplex virus type 2 conjunctivitis should be treated with intravenous acyclovir for minimum of 14 days to prevent systemic infection. Erythromycin Ophthalmia Neonatorum or erythromycin ointment of the eye at birth is administered for the prophylaxis of gonococcal Ophthalmia Neonatorum at birth. So if a baby took TTC ointment or erythromycin ointment at birth, that's just to prevent gonococcal Ophthalmia Neonatorum than that of Chlamydia trachomatis. It doesn't prevent Chlamydia trachomatis. This is all about what I have regarding Ophthalmia Neonatorum. Thank you for listening.